Dr. Nicolò Zarotti is a clinical psychologist in neuropsychology. He completed his undergraduate and postgraduate degrees in psychology at the University of Trieste in Italy. He then moved to the UK in 2013, where he went on to complete a PhD at Lancaster University, focused on emotional processing and communication in Huntington's disease. Since then, he has been carrying out research aimed at developing psychological approaches to the understanding and treatment of psychological difficulties in adults with neurodegenerative conditions. This led him to co-author the first BPS National Guidance on Psychological Interventions for people with Huntington's disease, Parkinson's, and other disorders, and has over 30 published research articles. After obtaining his doctorate in clinical psychology from the University of East Anglia, Dr. Zarotti joined the Department of Clinical Neuropsychology at the Manchester Centre for Clinical Neurosciences, where he currently carries out his clinical and research activity as clinical psychologist within the outpatient services. In 2023, he also rejoined Lancaster University as an honorary clinical lecturer within the Division of Health research. His main research interest revolves around psychological and neuropsychological approaches to mental health and cognitive difficulties in people with motor neurodegenerative conditions such as Huntington's, Parkinson's, and others. So thank you very much for your patience. Sorry about it. We're all up and we're ready to go.
Right, so we will need to, do we have a microphone that we can share around? Okay. Oh, this one. Okay, thanks. Thank you very much, everyone. I was hoping to make this a bit more interactive, but sadly, Mentimeter is not working. But thank you very much for the introduction. Very quickly, the aims for today would be to talk about psychological difficulties and how they can present in Huntington's disease, and discuss the challenges that may be at play when trying to provide mental health support for Huntington's disease. Now, I want to make it clear since the very beginning that there is not going to be any disease planning here in terms of me, a psychologist, telling you people impacted by HD how you should be feeling or why or what sorts of difficulties you should be feeling as a person impacted by HD, because you guys are, in fact, the real experts about this, because you guys are the ones that are going through these difficulties. So we're here to hear your thoughts and your experiences. This was supposed to ask you to pin yourself on a map to show where you're from, but just raising your hand, who's from Europe here? Who's from the US? New Zealand? Oh, that's a long way. Asia? Okay. Anybody from Antarctica? No. Yes, Canada, sir. Thank you. It's most topical that you are your own country. So, what is psychological support? Just a very quick introduction. So we're talking about strategies and interventions that help alleviate psychological distress, things such as improving coping and resilience, and promoting overall mental health and well-being. Some examples you may have come across of these sorts of interventions might be psychotherapy, things like CBT, so cognitive behavioral therapy, systemic therapy or psychodynamic psychotherapy, psychological counseling, or even just certain techniques for stress management such as mindfulness. Now the question here was for you to tell me and to tell the whole audience, why do you think we need psychological support in HD? What sorts of psychological difficulties do you or your family face, you think? Just shouting out.
There we go. Oh, I thought you raised your hand. Okay.
A big one I see is guilt, and it comes in many forms in this community, and a lot of people just try to shove it down instead of thinking why do I feel guilty and stuff like that. And I feel like guilt is one thing that is very overlooked in this community.
Frustration, especially like if other family members are going to do things differently than yourself.
Maybe if you feel overwhelmed and you just don't know how to handle things and accept, then it's still okay, even if you would decide to behave differently than people expect from you.
PTSD from the way our parents were living with Huntington's.
Sorry, again, this was supposed to be much more interactive, but that's 2025 for you. So what does the literature say? This is all very topical. We know that the literature tells us, and again, this might very well differ from your experience, and there's nothing absolutely wrong with that, but there are a number of significant emotional and behavioral problems associated with Huntington's. So we know that anxiety, depression has been mentioned, irritability, aggressiveness, agitation, apathy. And we know that the literature actually shows us that compared to motor issues, psychological difficulties or cognitive difficulties tend to be stronger predictors of quality of life. So people impacted by Huntington's tend to say that having those difficulties tends to have a bigger impact on their quality of life. And obviously there's the impact of genetic testing. But one point that I really want to make today is that there's also been quite a traditional biomedical framework when conceiving psychological difficulties in Huntington's disease. And that biomedical framework has traditionally said that anything happening mental health-wise in people with Huntington's is due to the brain that is degenerating. And in fact, we know that the literature tells us otherwise. Not everything is due to brain degeneration, and Huntington's is far more than just a brain disorder. And we did this 5-point manifesto to sort of try and push this idea through. You can scan all these QR codes to download the papers. They're all freely available. In this manifesto, we make clear that it's important, first of all, as I said, to listen to people who are affected by HD, because you guys are the experts on this. Reformulating difficulties psychologically means that if you are depressed, if you are feeling upset, anxious, it's important to realize that you're all still human beings, and Huntington's is just something added on top of everything that people go through in everyday life. And as human beings, we all go through a lot of shit, especially this year. I mean, there's been a hell of a start for this year, haven't it? So that doesn't change if you have Huntington's. It doesn't change your work life in terms of having to find a job, having to maintain a job. You know, everything that everybody goes through, people with Huntington's go through the same, just with the added issue of having Huntington's on top. Exploring new interventions, and we'll see why in a bit, increases psychological provision, and learning from other conditions. I think that's quite helpful in terms of looking at other conditions where psychologically informed approaches have been developed a bit more. And one of such conditions, I think, is Parkinson's disease, where the Parkinson's community has been quite vocal through the work, for example, of people like Michael J. Fox, with regards to improving psychological approaches. Again, this was supposed to be on the screen, but what is your experience of receiving psychological support for HD? Are you currently receiving any? Have you received any in the past? Have you had any barriers to receiving it?
I saw a therapist after my dad passed, but they gave me like a time frame, and it was only for, I believe, 10 to 12 sessions. And so I built like a great relationship with her. I loved her. But unfortunately, it had to end at some point. So it's like kind of like, it's frustrating when insurance only covers so much, and then you have to build a new relationship and educate someone else on the same thing. Because unfortunately, there's not really like a long-term therapy option for most people that is completely covered by insurance, at least in the U.S.
With my dad, he has a lot of behavioural symptoms and not really physical symptoms, and we've found every time he gets evaluated, it's almost just like a checkbox exercise, and they just come back and say, oh, he's depressed, but they don't help with any of the behaviour issues that we're trying to treat.
If you did go to see someone, did that person know about HD?
I got some funding from the local association in New Zealand to see a therapist that they had put forward as a Huntington specific psychologist, and the person didn't know anything about Huntington's, so that was disappointing.
So, yeah, there's quite a few barriers, and we've tried as a group to try to see whether the evidence anything with regards to psychological interventions in people with Huntington's. This is a review that carried out back in 2020, and I think to this day is still the only review on this topic. And again, you can scan the QR code to download it, but basically what we found is that the literature is extremely sparse. And we started off with around 1,500 citations and considered fully around 15 papers, eventually included 9, and only one of these was an RCT. And I think to this day, that is still the only RCT available for psychological interventions in HD. So we also wanted to set out to try and understand why there is this paucity of psychological interventions. And this is a study that I carried out in collaboration with the Lear Foundation in Italy, when is led by Barbara D'Alessio and Ferdinando Squitieri, who was on the panel for the Hidden No More chat. And for this study, again, you can download it with the QR code. We interviewed 14 people, 7 individuals with early symptomatic HD and 7 caregivers. We did a qualitative analysis called thematic analysis just to try and understand the narratives around their experience, finding these themes. Now, I'm not going to go too much into details, but I'm now going to show you what we found in terms of their experience with some of the quotes. And so these were participants in Italy. And I would encourage you to snap your fingers if you relate with any of those quotes at any point, just to see how many of you might have experienced the same. So the first was the psychological support for HD is very hard to access and is hardly adequate because of lack of public provision, where there is public provision, and absence of assistance at the time of testing, and significant differences in healthcare administration. And some HD organizations appear to be sort of stepping in terms of providing that informal support. So these are some of the quotes. Anybody can relate with something like that? Yeah. And then barriers to accessing psychological support. There were numerous barriers: the cost of therapy, the generalized, sometimes distrust in public healthcare. We know that in Italy we have public healthcare, but people don't really trust it for some conditions. Lack of knowledge about HD. Again, how many people have you seen sometimes? I had a patient that I'm just going to digress very quickly, but I had a patient who told me once that she was at risk, and she had been told by her family physician that her mom had HD, and she had been told by her family physician that she was in the clear because HD is only transmitted by fathers. So, that's where there are no words really, but we're talking about people who are fully qualified clinicians and are still very unknowledgeable when it comes to HD. Anybody relates to any of these quotes? So I saw a psychologist, she barely knew what HD was. She said to me, I've heard about it once told my associate psychologists, they told me that there would be money down the drain because only fools see psychologists. Or I could not afford to see a psychologist. And then enablers, what actually helps to accessing psychological support in that case is receiving advice from HD organizations, finding the right clinician for therapy, and seeking therapy for other reasons, and potentially receiving some discounted fees when going privately. So has anybody related to any of these quotes, for example, having HD organization staff giving you contact details for clinicians, or having to find the right person for you to feel listened to? Thanks. And then the last theme was about future development of psychological provision. So how can we improve this? And we'll get back to you in a moment to give us some ideas. But this was mentioned as potentially having a single number to call for people with HD or their families to be able to access that support. And I think another very important point that was made is about the fact that also caregivers need to be able to access support and not take everything on their shoulders. Because HD is not, again, just a brain disorder, but it's also a family disorder. And it's a disease that affects family systems in multiple ways. And from a psychological point of view, being born and raised in an HD family can have a massive impact. So just wanted to make it a bit more interactive now again. What can we learn from all this? Well, obviously we need to listen to you guys because you are the experts about the condition. So over to you. My question to you at this point, and again, this was supposed to be interactive, but how can we make psychological support better for you guys? Any points I find, just brainstorming really, anything that pops up.
I just want to share one thought. For me, it was also really hard to find psychological support, but now I'm in therapy since 1 year, and it's mostly about talking about. It's not. I don't know. It helps just talking about it. So before that, I didn't have any kind of community or people that I can actually talk to. But what we really need is maybe a support group. You can have that online if you have no access to any psychologist. What I mean is also support groups in the HD community can actually help against depression, against anxiety, just by sharing your stories and actually talking and talking and talking. It's all through 10 times. I needed to do it 5 years now. I have this support group. And today I feel so much more released. And I never had a psychologist before because I couldn't find any until this 1 year now. But what I found out now after 1 year of therapy, it's actually the same. It's just talking about all the shit with someone. Actually, it really helps.
Thank you. I think just understanding the condition and the way the symptoms can present and not being dismissive. I've heard people say, oh, you could get hit by a bus tomorrow. I actually find that to be quite dismissive to the feelings of a genetic condition and the family element of it as well.
Adding to our thoughts, I think trying to erase the stigma around the disease, because I think a lot of people still really don't know what it's about, try to portray the right sides, the right stories, what we want people to hear, the good and the bad, make ourselves heard around the world. I think that's the point we need to drive home. People are not alone. We need to take as many steps forward as you can, as fast as we can, so that we can grow this community that has been amazing, and we can help as much people as we can.
Since we have so many different countries, representatives, and languages, I think you're absolutely right. You're not alone, but also language can help us understand it. So I'm originally from Italy, and it's amazing to see how different languages all have the same way to stigmatize and use very eerily similar expressions. So in Italy, we tend to say, "I panni sporchi si lavano in casa." So you wash your dirty clothes inside the house, so that you don't talk about bad things outside. In English, it's you don't wash your dirty linen in public. And all these sort of very stigmatizing ideas where, when something is so intrinsically linked to your family, you don't want to talk about it because you don't want other people to talk about you in public, And I don't know if you have examples from other languages. I would love to hear that, but you're not alone in this. It might feel like it's related to your culture, but no, we're all human beings, and this is a very common thread all over the world.
Just one thing for you. I think same as he said. Also, as a professional, you have to use your network with other psychologists, because we don't have the network. Like in Germany, we have like 1 or 2 specialists in HD, like as a psychologist, and they need to use their networks because we don't have them. And I think also spread awareness around the medicine and the therapy. Yeah, you know what I mean. Sorry.
If they don't, it might be handled.
I was going to say, could there be some sort of education component from HDYO or a similar organisation that psychologists could opt to use to learn how to deal and understand with HD, and also like a registry, so that if they did that, they could have, how you have like little pride badge if you're a safe person for that, have a little HD badge of a safe HD therapist.
So yeah, in response to that, there is, and I can give you the details when we finish, because I don't have it here. But if you go through my ResearchGate profile, I'll show you where. We actually produced some guidance with the Registered Psychological Society for clinicians to understand Huntington's and to navigate psychological approaches for HD. We are in the process of doing one for the Italian HD community as well. But yes, absolutely. And this is actually where I think organizations can be really helpful, stepping in and providing that education. Because as I said, any clinician worth their salt will have that intellectual honesty to say, I don't really know about this, but I will try and educate myself. And that's what organizations really can help with.
Maybe there already is something like this out there, but what about a platform like a Reddit that was informed by psychologists and psychiatrists that were affirmed in the community, but where people could actually ask questions and, this is what I'm experiencing. Is there somebody else out there that maybe had the same experience, and what did you do? So it's all of us and all of the researchers combating common, I know it's not, common is a tricky word, but questions that we might all experience, and through the stages, and what did you do, and tricks of the trade, perhaps?
Actually, just to say that the European Huntington Association is actually working in a kind of e-learning platform. Hopefully it will be released next month. And it's exactly about online courses, so online training, online education on several main topics related to HD, like psychology, like neurology, speech therapy, occupational therapy, nutrition, whatever. And what it makes it really unique is that it was created by family members and professionals with an expertise in HD. So it was not abstract theoretical knowledge. We interviewed people from 3 countries, so Belgium, Spain, and Bulgaria, so 3 different European realities, and all these people contributed to create the contents of these e-learning courses. So hopefully there will be something soon.
What I can see as well as quite a big problem, we're talking here about missing specialists for adults, but what about kids? There it's even worse problem. I can see it by my son. I've got a son who is 10 years old and he's at risk. And yeah, for him it's very painful to watch his sick daddy. Well, luckily we don't live anymore together. I left my husband 4 years ago, but I'm still taking care for him, and he's still part of our life, although I do have a new life. But yeah, it's very difficult to find any help, any support for my son, because yeah, for kids it's even worse. And okay, I'm from Czech Republic. Here it's very difficult, but I think it will be everywhere. So, and even when I taught with Dr. Uhrova, who is Czech psychiatrist from HD organization, and she knows a lot. She was like, yeah, I feel so sorry, I cannot help you, because, yeah, with kids, the work is completely different, and we can't just help them. And this is frustrating. It's like for us as carriers, it's like, okay, we can handle it somehow. Well, it's not easy, but okay, but what about kids? Yeah. They are affected.
So I'm not a child psychologist, so this is not within my remit of expertise clinically, but absolutely that is an essential point. And children, in fact, are the ones that are going to experience most of the psychological impact early on in life, because we know that being born and raised in a family with HD has an impact on attachment styles, has an impact on the family dynamics, relationship between siblings, guilt, survivor's guilt, why me and not him, her, vice versa. So all the things that we discussed today apply just the same for psychological support for children. So if you do find a good child psychologist and they don't know HD, they should have the intellectual honesty to say, well, I'm going to inform myself, I'm going to educate myself, and you can try and advocate for that. Unfortunately, there isn't much in place as far as I know with regards to psychological support for children. We are trying to build the evidence-based. We have just in the process of doing some studies with regards to the impact of trauma early in life within HD families, and the way that can also lead to psychological difficulties in adult life, but it is an essential part of that as well.
I just want to touch on what was just said there, because me growing up, I found out about my mum when I was in school, and there'd be times where, you know, she'd be in an ambulance before I even got to school, and I went to school and I pretended like nothing happened. I went on with my day, and that was the norm, and that was going to school, and that was growing up. And it kind of frustrates me that, sorry, I'm going to not get upset, had to happen, because that should not have been the case. There should have been intervention, and there should have been therapy, because, you know, it was just like you just had to get on, and you just had to, and that is the way. And I do think that it's affected the way I deal with it now, and the way that it's, you know, manifested in my life. So I do think it's really important for kids growing up impacted by HD that they don't feel like they're going crazy, or they don't feel like they have to carry the burden, because you just,
it's just going through the motions. Yeah, you just feel a bit invisible. So, yeah.
Well, I'm happy to answer any questions or any comments later. So we're eating into the next presentation, so we need to stop. But just want to leave you with one consideration, is that obviously what we all hope is that tomorrow a research team shows up and says, we've found a cure for the condition, we can just give you this pill and silence the gene, and that's it. And there will not be any other issue linked with HD. So obviously finding a cure is extremely important. But until there is a cure, there is care. And care, the object of care, the focus of care, is not a disease, it's people. So you are the object of care. You are the focus of care. And don't you ever feel like you are not in the position to ask for help, because that is exactly what care is for. Thank you.
Thank you very much. We can let